Bismillah ar-Rahman ar-Rahim. In this video, we will talk about cancer epidemiology. Cancer epidemiology is an important topic because it tells us how common is cancer, which population is affected by cancer, how the trends of cancer are changing. Let's start with the situation here in Jordan. Do we have statistics regarding cancer in Jordan? The answer is yes, we do. لأنه من 98-99 بلش الكانسر ريجستري اللي يلزم كل مستشفى بالأردن إنه تعبي فورم لكل مريض بيدخل للمستشفى ويشخص as كانسر. هذا الفورم فيه معلومات عن المريض، عمره، الجندر، the diagnosis and so on. كل هاي الفورمات بتروح لوزارة الصحة، بنعملها statistical analysis وبتنتشر بكتاب كل سنة. As you can see here, this figure shows how cancer is increasing in Jordan. There's a steady increase. من 92 اليوم cancer in Jordan is increasing and it is expected to increase further. So this is a huge problem. What's the effect of cancer on an individual? What's the burden of cancer? بدي منكم لو سمحتوا وقفوا الفيديو for a few seconds and read this scenario. Once you read the scenario, لاحظوا احنا بنحكي عن female, she had breast mass. This lady has undergone surgical treatment. انشال لها البريست ماس بالإضافة للأكسيلري lymph nodes، لأنه أصلاً الكانسر مشكلته إنه مش localized، مشكلته إنه بينتشر بالجسم، بيروح على lymph nodes through lymphatics and it goes to distant sites through blood اللي بنسميه metastasis. Lymph nodes were removed. This lady had problem in her arm لأنه الليمفاتكس أصلاً هي بتاخد الإكسترا fluid، هي جزء من الفلويد بالانس in our body. لما الليمف cannot be drained بتجمع inside the arm and this causes swelling، وبعدين هذا ممكن يعمل pain أو ممكن يعمل complications. So the patient is suffering physically due to her cancer and due to the treatment she received for cancer. So she has disease state and this is comorbidity. So the patient has, any cancer patient will have morbidity related to cancer. But also cancer can cause death. هاي المريضة أمها ماتت من 2 من cancer. So cancer causes mortality. إذن في two major issues related to cancer. Cancer morbidity and cancer mortality. بس مش هذا وبس، إحنا جزء كبير من مشكلة الكانسر إنه it causes emotional disturbances. It's a life-changing event لما تحكي لمريض إنه عندك الدياجنوزس تبعك is cancer. Also, the burden of cancer spreads to the family, to those who love this patient. It's not just a health problem affecting one individual. It affects families, it affects communities. ومشكلة أخرى بالكانسر إنه الcost of treating cancer is very high. وهذا بيردن على البيرسون نفسه، على الفاميلي، وممكن على الجوفرمنت and so on. So the burden of cancer is related to cancer morbidity, cancer mortality, emotional problems related to the diagnosis, and financial issues. So it's a huge burden. Can we decrease this burden? شو احنا نعمل لمرضى الكانسر؟ يعني الدكتور الشاطر صحيح بشخص كانسر وبيعالجه، بس الدكتور الأشطر اللي بده يحاول يمنع حدوث الكانسر. Can we prevent cancer? شوفوا لي، خلينا نشوف this scenario. A male complained of cough and then he developed hemoptysis. شو معنى hemoptysis؟ hemoptysis معناها coughing blood. heme يعني blood. So this patient is coughing blood. Now coughing blood is a dangerous sign. مش دايما معناها cancer by the way. Tuberculosis can cause hemoptysis, but hemoptysis is a major symptom. When a patient has it, you must do investigations. هذا المريض نعمل له chest x-ray ولقينا عنده mass. لما سألنا عن ال history of smoking, he said that he smoked since he was 19. إذن, this patient has cancer. It's a dangerous cancer. It can kill him. But this could have been prevented. لأنه there is a cause for his cancer which could have been avoided, اللي هو smoking. So cancer can be prevented. And preventing cancer هو أحسن إشي إحنا ممكن نعمله للمرضى وللcommunity as a whole. Try to prevent cancer. How can we prevent cancer? في certain behavioral changes, if we do them, we can decrease the incidence of cancer. The estimation is around 30 to 50% of cancers are preventable. تخيلوا قديش كتير، 30 ل 50% of cancers can be prevented عن طريق decrease obesity, decrease in activity, يعني increase physical activity, decrease junk food. You need healthy food which is rich in fruit and veg. Don't smoke and don't drink alcohol. Smoking بالذات is a very important factor. The estimation is 22% of cancer deaths are related to smoking. So we can prevent cancer. ثاني بنقدر نعمله other than prevention? The answer is yes. We can screen for cancer. Screening معناها إنه أنا بشوف population which is at a high risk of a certain cancer, and I do certain tests for them to find out the pre-malignant lesions they might have, or to find out the cancer at a very early stage before it spreads, before it can kill. And I treat these patients. So I'm discovering the cancer at a very early stage, and this early detection is very important. هنقدر to detect early by screening and by educating people. لازم ناس تعرف شو signs and symptoms الخطيرة اللي عشانها لازم أروح المستشفى، لازم أفكر إنه I need to be investigated. So screening is very important. Screening has saved many lives. الكولونوسكوبي اللي هي تنظير الأمعاء can be used to detect pre-malignant lesions that occur before colon cancer starts. If you detect these and remove them, then you are saving many lives. لأنه خلينا هذا المريض عالجناه قبل ما يوصل لمرحلة إنه يصير عنده cancer. So screening من الأشياء المهمة ممكن نعملها for our patients. About incidence of cancer, what are the common cancers? In Jordan, the most common cancer among males is lung cancer. بالفيميلز it's the breast. لاحظوا أنا حطيت for countries كلهم بالفيميلز the most common cancer is breast cancer. So this is a very common cancer. عشان هيك breast cancer screening is very important. In the males, Jordan lung هي most common. أكيد السبب السموكينج. Japan stomach cancer هو most common، بينما USA and UK prostate cancer is the commonest. إذن الانسيدنس of cancer مش بكل العالم نفسه، بيختلف من بلد لبلد. هذا الاختلاف related to genetics ولا to environmental factors. Nowadays we know إنه the environmental factors are more important than genetic factors in causing cancer. Still genetic factors important. في cancers which are inherited. في certain genes that people inherit that makes them more susceptible to develop a certain cancer. Again, it's very important to notice that environmental factors are more important than genetic factors in causing cancer. الأشياء من أوائل الدراسات اللي خلتنا نعرف إنه الكانسر is related to environmental factors أكثر من genetic factors هو studying cancer incidence among immigrants. يعني اليابانيين اللي عايشين في اليابان عندهم stomach cancer كتير، عندهم البريست كانسر موجود among females, and it is the commonest cancer in females. However, the overall incidence of breast cancer in Japanese living in Japan is much less than the incidence of breast cancer in those who were born in the USA. طيب لو أخذنا ناس يابانيين هاجروا ل United States of America, what we found that with successive generations there is an increased incidence of breast cancer, وبعد several generations the incidence of breast cancer among Japanese immigrants becomes very close to native United States population. So why is this? الجينيتكس تغيرت؟ ما تغيرت. الياباني اللي انولد في اليابان والياباني اللي عاش باليو اس اي they have the same genetics، ما تغيرت. اللي تغير اللايف ستايل. ليش with each generation المسألة بتصير أسوأ أو بصير modification للإنسيدنس بحيث إنه يقترب من النيتيف population؟ السبب إنه مع كل generation بصير more and more adaptation to the new lifestyle. يعني مثلا الياباني اللي عايش في اليابان أكثر أكله سوشي. الفيرست جنريشن اللي هاجر لساته بحب السوشي. السكند جنريشن رح يضل ياكل سوشي بس they will eat more burgers. يمكن الثيرد والفورث جنريشن they will eat only burgers and sushi becomes something from the past. The lifestyle changes cause changes in cancer incidence. And these studies on immigrants كانت واحدة من أهم الأشياء اللي خلتنا نعرف إنه إنه cancer is related to environmental factors. So now let's talk about cancer and age. What's the relation between cancer and age? Is there a relation? The answer is yes. Cancer increases with age. The incidence of cancer increases with age. In the United States, the median age at diagnosis is 66 years of age. ليش؟ لأنه كل ما الواحد كبر بالعمر the environmental factors that cause mutations will increase. فبصير في more and more accumulation of mutations which will cause the cancer. السبب الثاني إنه with aging immunity decreases, and when the immunity decreases this can enhance the cancer. Then cancer increases with age. However, there are certain cancers that occur in children. هذا من الجوردانيان statistics. في عنا childhood cancers. The most common leukemias and lymphomas, those are very common childhood tumors. CNS tumors are also common childhood tumors. بالأردن الآي كمان is common. Bone tumors are also common tumors that occur in children. كون الtumors are related to environmental factors, then the incidence of tumor can change with time if the environmental factors change. يعني احنا بنقول lung cancer in Jordan is common. ليش؟ لأنه smoking is common. طب if we decrease smoking, the lung cancer incidence will decrease. The example of how pap smears have changed cancer incidence. الباب سمير اللي هي cervical smear، مسحة عنق الرحم اليوتيروس في له عنق اللي اسمه cervix. Now the cervix إذا احنا حطينا spatula وأخذنا cells from the uterine cervix من عنق الرحم ضل حطيناها على سلايد شفناها تحت الميكروسكوب we can discover pre-malignant stages of cancer. So in the West screening of cervical cancer screening is common. فبالتالي the incidence of cervical cancer كان عالي but it decreased when screening occurred. نفس الشيء اليو اس اي كان عندهم الكولون cancer common. Nowadays الكولون cancer in USA is decreasing. In the United Kingdom decreased شوي بعدين هلا وصل plateau. عندنا لا colon cancer is increasing and it is expected to increase لأنه still we are not good at screening. So the trends in the epidemiology are not stable, they change with time. These are the main ideas about cancer epidemiology. In the next video we'll talk about cancer nomenclature. Thank you.